offer hope to those affected. My name is Hassan Natula.
My name is Demari Kewari, and today's program is proudly powered by Teledoc, a secure digital platform that allows you to consult verified doctors anytime, anywhere. With Teledoc, you can book a quick consult for 10 minutes or a full consult for 30 minutes. Choose your preferred time, join a secure video call within the app. You can also upload your medical records and receive prescription after your consultation. Every Wednesday and Thursday, we feature trusted doctors from the Teledoc network to answer your health questions live. We have Dr. Toke Olabanji, who will help us understand fertility, infertility, and the appropriate pathway to evaluation and treatment. Doctor, welcome to Radio Doctor.
Good morning. Glad to be here. Thank you for having me.
Morning. The phone lines will be open shortly for you to ask your questions, but before then, the time is 5 minutes past 10. This is Radio Doctor on Women, Radio WFM 91.7, Nigeria's first and only radio station for women and their families. The doctor's details will be shared at the end of the program.
All right, Doctor, once again, welcome to the program.
Thank you.
So let's dive straight into it. What exactly is infertility?
Infertility can be defined as the inability of a couple who have been having regular, unprotected intercourse to conceive after 12 months of being together. So regular intercourse would mean intercourse of at least like 3 times in a week for a period of 1 year.
Okay. Okay, thank you, Doctor. How common is infertility in Nigeria and then globally, if we put in context?
Okay, so globally, the prevalence of infertility is put at about 12%, 12 to 15%, depending on the data or statistics you're quoting. Data in our part of the world is slightly it needs more work, okay? But as at the last time data was collected, the prevalence was put at about 30% for West African sub-region. So for the West African sub-region, it is as high as 30% as the prevalence of infertility.
Thank you, Doctor. So at what point should a couple become concerned if pregnancy isn't occurring?
Okay.
I know you mentioned the 1 year period, but is that it all?
Okay. So for a woman that is less than 35 years old, okay, sees a period regularly, okay, and there are no problems. Her periods are regular, no issues with her period. And after marriage, and she has been with her husband, she's expected to try conception continuously for a period of 12 months at least. Before, if nothing happens after 12 months, then she should be worried. But there are certain exceptions to this rule. Okay, so now for a woman 35 years above 35 years, newlywed, people, the age we're in now, people delay reproduction and marriage because of career and all these other and a lot of other things. So people tend to start their reproductive career later. So for people who are 35 years and above, they should be, as in such people, once they get married and they present even after a few months with inability to conceive, such couple should be investigated immediately. Okay. Also, for a certain group of women, now I'm talking about the women part. It's not like men don't have their own. I'll also come back to the men aspect too. So, but I'm taking the women aspect now. So number one, I already talked about the women 35 years and above. So also women who have certain medical conditions that can impair their fertility. Women who are diagnosed with endometriosis early in their reproductive life, they should be investigated once they want to immediately want to start their reproductive journey. They should be investigated. And women who have had certain conditions, such as Asherman syndrome, delayed secondary sexual characteristics with the development, because this can point actually to some congenital diseases. Those are diseases that are actually maybe the woman was born with, or abnormalities that occurred in the woman during development that will predispose the woman to infertility. So women with certain endocrine disorders such as thyroid diseases. Thyroid disease can be hypothyroidism, hyperthyroidism, could be diabetes mellitus, okay, and congenital adrenal hyperplasia. Okay. There are also some a lot of congenital diseases that once a woman is found to have, you don't wait for a period of 1 year to investigate. So once a woman has certain things that a physician, a doctor thinks, a gynecologist thinks might predispose her to being infertile, the woman should be investigated immediately. Okay. So on the part of the men, there are certain men also who have certain abnormalities right from birth that predispose them to. But a lot of times, some of these abnormalities come with some other symptoms that would trigger, that would prompt a doctor to carry out investigations on fertility. Also, men who have had mumps orchitis. Mumps is a viral disease, and the virus, when it attacks, most of the time, it also attacks the reproductive system of men. Also, so making sperm production, affecting sperm production. So men who have had a history of mumps should be investigated. Okay, chronic diseases, men and women alike who have had chronic diseases such as tuberculosis, okay, should also be investigated for fertility. In this category of people, you don't wait for 12 months. Okay, so.
Okay, thank you, doctor. The next question I actually had, you just answered it, which was if it's a woman's problem or can men be responsible, but we are aware now that it can be anybody's problem. My last question for you would be, what are some of the common myths about infertility that people should stop believing?
Sorry, I didn't get that, please.
Some of the common myths that about infertility that people should stop believing.
Okay. All right. So before I go to the myths, I just want to buttress another point. You said you wanted to ask a question earlier, but I already answered it. So that men actually have an equal amount of opportunity to be the culprits in infertility as much as women do. Okay. So 40% of the time it can be the man that has the problem, and also for about 35-40% of the time it can be the woman, and 15 to 20% of the time it can be combined or unexplained infertility. So that's that for that. Myths about infertility. The myths about infertility are so much that with them as people are getting more educated about a lot of things, a lot of interventions, a lot of these myths are getting debunked. So, for example, like people in the old days used to believe that once you were unable to conceive, as in people who were unable to conceive were termed witches and all that. And then there were also a lot of myths about fibroids. That once you have a fibroid, you definitely will be unable to conceive. But that, we know now definitely that having fibroids does not automatically mean you will be unable to conceive. Having fibroids, it depends. For one, it depends on the location of the fibroid, most importantly. Okay, and also the size of the fibroid. Okay, women who have the type of fibroids that interfere with pregnancy mostly are the submucous ones. What do I mean by submucous fibroids? Submucous fibroids are those fibroids that lie directly underneath the lining of the womb, the inner lining of the womb. That's the endometrium. Okay, so the submucous fibroids are the ones that lie directly underneath the inner lining of the womb. They are the ones most associated, that have been found to be most associated with interference with pregnancy and all that. The other types, which are the intramural, the subserous. The intramural is the one that is located majorly within the muscular layer of the uterus. And then the subserous are the ones that lie on the outer part of the uterus. Okay, so the intramural, depending on the there are classifications of there are WHO classifications for fibroids also. So it will depend on the classification of the intramural fibroids. That's what will actually determine if it will interfere, if he has the capability to interfere with pregnancy or not. But majorly, the fibroids that have been found to interfere significantly with pregnancy are the submucous types. Okay, and we have found in our environment that a lot of women actually are found to have uterine fibroids coexisting with pregnancy, and a lot of these women carry pregnancy to needing admission. Okay, so that's one. Another myth is the one that I was talking about, witchcraft and all that. So there are some people don't see their periods over a number of months. You understand? So the whole days, due to ignorance, a lot of those kind of people were termed witches or having offended someone or something. But with education came more enlightenment, and we found out that some of these women actually had hormonal imbalances. Okay, they had, even some of them had ailments that that made their period cease for certain periods. And on investigation actually reveals, thorough investigation actually reveals some of these ailments, and also a lot of these women that have had treatment, have had thorough investigations, and have gone ahead to conceive and live a happy life. And for some people who have unexplained infertility, that even the husband and the wife have been investigated and no cause has been found for. Some of them have actually, a lot of them, not some of them, a lot of them have actually undergone fertility treatments, such as intrauterine insemination, in vitro fertilization with embryo transfer. Currently they live happy lives with their children and all of that. So the field of infertility has at this stage now is offering so much solution to a wide range of ailments, and is actually debunking a lot of myths that people used to have about infertility in the old days.
All right, doctor. How can untreated sexually transmitted infections lead to infertility?
Okay, thanks for your question. So Untreated sexually transmitted infection depending on the organism, on the culprit involved, has the capability to make the environment toxic to the ascension of for fertility to occur. A man has to meet a woman, sperm introduced into the vagina. The sperm, you have to have motile sperms capable of swimming to meet the egg within the ampullary region of the fallopian tube for fertilization. And then the fertilized egg forms an embryo, which is then transported back to the uterus, where it begins to burrow into the uterine wall. Any infection can interrupt any of this line of this series of events. Okay, it can make the environment toxic for sperm, can make it toxic for even eggs. Okay, infections can cause injury to the fallopian tubes. Once the fallopian tubes are very delicate structures, once they are injured, they become blocked. Once they are blocked, fertilization does, because it is inside the tubes, fertilization is supposed to occur. Okay, so once the tubes are blocked, fertilization, there's no way for the sperm and the egg to meet. Fertilization is virtually impossible. In addition, infections can enter into the peritoneal cavity and cause a condition called pelvic inflammatory disease. It can cause adhesions in all these areas, and then once adhesions are formed in the pelvic area, fertility actually becomes a very, very difficult feat to achieve. Okay. Two major groups of organisms, two major organisms have been found to affect the tubes, especially sexually transmitted infections. Gonorrhea, Neisseria gonorrhea, which causes the common gonorrhea we know, and then Chlamydia trachomatis. Now, Neisseria gonorrhea is a louder form of organism. Like if it infects the tubes, it's loud. Okay, you will know, you will feel its presence. You feel the same. The carrier will feel the symptoms. Okay, there might be discharge of foul smell. There might be discharge of foul smelling fluid, yellowish fluid, much like pus. Okay, ultrasound will pick accumulation of fluids in the pouch of Douglas, significant amount of fluids. The woman will complain of significant abdominal pain. Okay, so but the more quiet one, the chlamydia, is the more dangerous one, because it acts very, very slowly, and then it really can be asymptomatic. It might not give any sign that it's in there causing harm. Okay, causes blockage of the tubes, causes damage to the pelvic structures in a slow and then quiet manner. And before you discover, all the vital organs needed for fertility, needed for reproduction, have been damaged. Most especially the fallopian tubes. Okay, so these infections majorly, these are the ways in which they destroy the tubes, to make the uterine environment toxic to the growth of embryos. So even semen can cause adhesions within the structure of the pelvis, thereby preventing even there are some structures they call fimbriae at the end of the tubes, which are supposed to pick up the egg after ovulation. The infection has the capability to touch all these structures and impair reproduction. I'm sorry, I'm trying as much as possible to avoid using bogus language and complicated so that I won't get anybody confused.
Actually,
Ma?
I was going to come to that actually, because we have a wide range of people listening to us, and some people might be lost.
Okay, okay. Apologies. I'll try as much as possible to limit the medical jargon, to remove the medical jargon out of the conversation.
Thank you. Okay, so can lifestyle habits like smoking, excessive alcohol, obesity, and stress affect fertility?
Okay, the factors again: smoking,
Excessive alcohol, obesity,
alcohol,
and stress.
obesity, and stress.
Yes.
Okay, so smoking, absolutely. Smoking can affect fertility. Okay, smoking can affect the man and the woman to impair infertility. Smoking in men affects the sperm, affects the semen parameters. Okay, so it
Mhm.
can reduce infertility both in males and females. Alcoholism too, absolutely. But in the case of alcohol, it depends on the level of alcohol intake. Mild and occasional alcohol intake generally do not affect fertility. But fertility has been found to be impaired in heavy drinkers, especially males. Heavy drinking has been linked with reduction in sperm parameters. Okay, so
Okay.
obesity. Can I go on?
Yes, yes. Please do.
Obesity. Obesity. Absolutely, obesity too has a role to play in fertility. Obesity a woman not to ovulate. It can disrupt a woman's hormonal milieu. It can disrupt a woman's hormonal state such that it predisposes the woman to not being able to ovulate. Okay, not only obesity, extremes of weight. Okay, a woman being either too lean, that's too thin, or being too large. Extremes of weight generally predispose a woman to infertility because the hormones become deranged. Okay, the hormones do not function well, and most of the people in this category they do not ovulate. They have ovulation issues. Okay, so stress.
Okay.
Now stress. It depends on what we call stress, or what you refer to as stress. Now, normal work. Some people term normal work as stress. Okay. Well, if normal work, if you refer to okay, maybe stress from work and all that, I don't think that has anything to do with infertility. Stressful situations that, as impose severe emotional burden. Yes, they can. Okay, because even during severe stressful conditions, certain substances can be released in the body. I'm not talking about normal work now, please. I'm making a distinction. During severe stressful situations, certain substances can actually be released in the body. So, these substances are meant to, as a coping mechanism, is a form of a coping, is a form of way the body reacts to stress. Okay, they are called coping mechanisms. So some of these substances sometimes can have an adverse effect on fertility.
All right. Thank you very much, Doctor. Over to you, Demi.
All right, doctor. Fertility concerns can be very personal, and some people may delay seeking help before because they don't know where to start. So, how can telemedicine help someone like that take the first step?
Sorry, please, can you come again? I didn't get the question.
I said fertility concerns can be very personal, and
Yes.
people may delay seeking help because they don't know where to start. So, how can telemedicine help someone like that take the first step?
Okay. So very, very important aspect of it, because fertility is a sensitive issue, especially in our environment. The African environment puts a premium on reproduction. Okay, once a woman gets married, there's pressure from in-laws, even subtle pressures from friends and relatives. Some people say words like, we are expecting, in a so amount of time, we are expecting so thing. Everybody knows what they are expecting. Some people ask questions like, have you seen your period? Have you not started missing your period? When was the last time you saw it? So people pry in our environment, okay? And this a lot of these questions, it takes a toll on the woman majorly. Okay, and also our environment is not an environment where you just everything you discuss with everybody. So telemedicine is actually it has become an invaluable tool in as a contact forum for women who have these problems. Number one, because it brings the woman it brings the person who has the problem in contact. A contact is established with a care provider. Okay, the contact is established most likely in an environment where it's just the man and the woman that are talking. The woman doesn't have to go to any facility for the first contact. Okay, trust is established from that first contact. The woman sees the person. If she's okay with the care provider, she can now go ahead and schedule a physical appointment. But that first contact, it brings the woman out from her shell. Okay, it brings the woman. It reassures the woman that, okay, what I'm going through, there is a solution for it. Okay, it gives the woman, even sometimes some of these women, sometimes there is a certain level of stigma that is attached to them. Okay, it reassures the woman that, oh no, I'm not alone in this journey, in this problem I have. Okay, so it gives the woman a lot of reassurance, and it emboldens the woman to seek further help. Okay, so telemedicine is actually, and then aside from all this, sometimes actually knowing who to talk to because there are a lot of people now in the country who call themselves health practitioners, health so. There are a lot of people who give medical advice about. Okay, so but another thing that I'm sure most people who operate telemedicine and all that they do, they go to lengths to verify the doctors they put on their platform. Okay, so the patient who has the issue is at least assured that, okay, she's going to be meeting a professional. She's going to be talking to someone who knows about her condition. That is another level of reassurance on its own, that, okay, I'm in safe hands. Okay, so telemedicine has come to play a very important part in managing these conditions. Also, for people who have issue with timing. Okay, in the comfort of their office, they can consult. People who do not have the time who do not have the luxury of taking out time from their busy schedule to leave their office and go to a hospital and queue. They can see a doctor in the convenience of wherever they are. They can see a doctor at the convenience of certain time that might not be feasible with physical contact. Okay, telemedicine has a whole lot of. If I were to dwell on, telemedicine is another topic that should be taken on a separate day alone. Like importance of telemedicine to healthcare, importance of telemedicine to infertility. Like it's a separate topic on it. The benefits of telemedicine is invaluable, really.
Thank you, Doctor. And that's right. On Teledoc, you can consult verified doctors privately, discuss your concerns. You can also review medical history, test results, and get professional guidance on what to do next from anywhere. You're
Definitely.
listening to Radio Doctor on Women Radio WFM 91.7, powered by Teledoc. With Teledoc, you can book consultation at your preferred time. You can join a secure video call, upload your medical records, and speak to your doctor. Receive prescriptions digitally. It is healthcare made simple and secure.
The lines are now open today on Radio Doctor. We are discussing infertility, the general overview. If you have questions about the causes, the treatments, the prevention, anything at all on infertility, this is the time to call in and speak to our guest doctor on 0800 or 09155 or 07917. You can send a text message, a WhatsApp message, or a voice note to 07031 756 or 08155 We are live on YouTube at WFM917.com, and you can listen to us on the go via our website at www.wfm917.com.
All right, doctor. So my next question is, why is it important? I know you mentioned that if a couple they've been having regular intercourse for a period of 12 months and they've not been able to conceive, at that point, that's when they should speak to someone and things like that. Now, why is it important for both partners to be evaluated together?
Okay. So, like I said, infertility is not solely a woman's problem. In spite of the fact that our environment has sort of made it a woman's problem majorly, but it is not solely a woman's problem. 40% of the time, up to 40% of the time, can be the man that has the problem. Up to 40% of the time, it can be the woman that has the issue. So, as in going by these statistics alone, it is obvious that a man and a woman have an equal opportunity